I'd like to introduce ourselves. Would you like to go first?
Sure. Hi, I'm Ashley. I'm a nurse practitioner. I work at Ear, Nose, and Throat Care Center in Barrington, and I've been doing that for about 9 years. And that's about it.
And my name is Dana Tress. I'm a physical therapist, and I specialize in treating individuals with jaw pain and disorders, as well as dizziness and post-concussion rehab. And I work at Smith Physical Therapy, and I run the Balance and Concussion Center. And we are so excited to bring this webinar to you today because we're seeing so many people that are coming in with jaw-related symptoms, and a lot of times they don't even realize that the dysfunction and complaints that they have are related to the jaw. So we wanted to share all of this information with you today. A couple of housekeeping things before we get started, just so that you know, in case you want to ask questions or anything, this webinar is being recorded. The link will be sent out to you afterwards within the next day or so that you can watch it on your own if there's information that you'd like to get ahead of and review if you miss it while we're talking about it now. And if you have questions during the presentation, down in the bottom right hand corner of the screen are 9 little dots, and you can click on those dots and then hit Q&A and ask a question through there. You can also type in a question through the chat, and we'll try to monitor that the best we can as the presentation goes on. And then Ashley and I we can unmute you at the end if you do have questions, and we can have a discussion and answer your questions live when we're finished with the presentation as well. So moving on from there, we're going to start out with talking about the anatomy of the jaw, because I think it's so important to understand what's happening in and around the jaw itself. There are so many structures around the joint that are responsible for the symptoms that people start to feel during complaints of TMJ issues. And so we're going to talk about the location of the joint, all of the motions that it has, and the disc in between the bones of the joint, musculature that's involved, and the nerves. We're also going to talk about the difference between TMJ versus TMD. And I think we'll start out with that. Everybody has a TMJ. We actually all have 2 TMJs. TMJ means temporomandibular joint, whereas TMD means temporomandibular dysfunction or disorder. So when you start to have pain related to the jaw itself, we call that TMD. But everybody has 2 TMJs, we hope. We're going to go through now and look at some anatomy pictures. As a physical therapist, we love anatomy and we geek out over anatomy. So we're going to talk about the joint itself. The jaw is composed of 2 bone structures. Part of it is the mandible or your jawbone, and the other part is your temporal bone in the skull, which is right above the ear. And those joints meet right here. And the interesting thing about where these meet is that you can see this hole right here. This is Ashley's area of expertise, but I'm going to hop on for a minute and cover it. This is the ear. So you can see how closely related the jaw is to the ear. In between the mandible and your temporal bone here is this white structure, and hopefully you can see that. That little structure there is the disc, and this disc helps provide a cushion between the bones. A lot of times that disc can be the source of a problem for clicking, popping, and especially when we hear people saying that their jaw is getting stuck or they can't close it fully, it is because that disc is problematic. That disc attaches to one of the key muscles involved in opening and closing the joint called the pterygoid muscle. We can see other muscles in this other picture here on the right-hand side that are involved in opening and closing the mouth. The biggest muscle that is involved in opening and closing the mouth is this guy right here. This is your masseter, and if you clench your teeth together, and you can see muscles popping out on the side of your face. That's your masseter muscle. So that one helps close your mouth. You also have this large fan-shaped muscle along the side of your head. This muscle also goes down and attaches to the jaw and helps close your mouth. That's your temporalis muscle. And so a lot of times when we have people complaining of headaches and head pain related to their jaw dysfunction, this muscle is involved a lot of those times. And then other muscles around the mouth and in the neck affect how the jaw operates. So we look at the neck in the front. We assess musculature in the back of the neck as well, because all of these soft tissues tend to overlap and react with one another. So we are not looking just at the musculature of the jaw itself, but also in the neck as well. And then when we peel back those muscles and look a little bit deeper into the anatomy of the jaw, we can look at blood vessels and nerves. And in this picture here, everything that's in yellow are nerves related to the jaw. And what we see here is the trigeminal nerve. The trigeminal nerve is a big nerve that comes out directly through the brainstem. So it bypasses the spinal cord and it controls all of the motor function of the jaw, but it also has sensory nerves that go into the ear, into the sinuses, into the gums, into your teeth. Am I forgetting anything with that? That's it. And so that nerve, as you can see, right where it comes out in here, is right where that joint is as well. So the jaw itself interacts with this nerve quite a bit. And then we also have a lot of blood vessels right through here too. And I'm not going to get into anatomically what all of them are, but pulsating, throbbing pain can be irritations through those blood vessels in the jaw itself. We're going to talk about causes of jaw pain in just a second. And Ashley's going to take over from here. You ready?
Yeah. So all kinds of causes for jaw pain. Of course, trauma to the jaw if you fall or get hit in the face or something that can cause some issues. But dental problems, muscle spasms, of course, teeth clenching that can be a result of stress, anxiety, and even medication. I have a lot of people that will, come in with a 6-month complaint and turns out they just started a medication, usually like an SSRI or like Lexapro or something like that, that can cause teeth clenching. And of course, we don't remove them off of that. They're on that for a reason, but maybe talking with their prescriber to see if they can change to a different medication or do some other kind of coping mechanisms or stress relief to try to help manage their symptoms. But that is a pretty common finding. And then arthritis, chronic pain conditions, of course, any growths that's my job, is to make sure nothing scary is going on in ENT. And then nerve pain is a very common issue too.
That's so interesting about the medications. Yeah. I actually didn't know that one. So I'm learning too, and I'm glad we're doing this.
Yeah, I'm like, did you start a new medication like 6 months? How long have you been on this? They're like, about 6 months, right around the time that it started. So yeah,
that's interesting.
Okay, so when you, a lot of people don't really think about seeing an ENT for their jaw, and sometimes, or very often they'll come in for every other reason but the jaw. So they have ear pain, sinus pain, headaches, neck pain, throat pain, any kind of other pain aside from the jaw. Maybe 1 out of 10 people actually present with jaw pain. And so what you can expect when you see an ENT is, of course, a thorough history, thorough head and neck exam. We need to make sure that nothing else is going on. More than one thing can be true at the same time. You can have, TMJ issues, but then also have some other ailment that we need to find out. So a lot of these symptoms overlap: ear disease, sinus disease, throat abnormalities. Of course, if your bite is off, growths in the neck, and degenerative changes in the neck. So then after we identify that the jaw could be an issue, we're typically referring to Dana or physical therapy for further evaluation and treatment, or maybe like a jaw specialist. And then if you fail PT, or I guess you're not improving, then we'll move on to imaging just to make sure we're not missing anything with the initial workup.
How many people do you see that are coming in swearing that they have an ear infection?
Oh, so many. There's so many. And so it makes it a little tricky too when people are very convinced that they're having an ear infection. So what I like to do is, we have a camera in the office. And so I will pull out the camera and scope their ear and show them that they have a normal ear anatomy. And then I can also put the camera in the nose and make sure that there's nothing going on where the eustachian tube drains that can also cause referred ear or jaw pain. So, but yeah, a lot of people are getting, multiple rounds of antibiotics and ear drops, and they're coming in saying that nothing has helped them, and it's because the wrong thing is being treated.
Yeah, so, I think that's the thing that I hear the most often when people come to see me.
Yeah.
So
yeah, ears are so hard. I've been doing this a while, and they're hard. So if you go to an urgent care or something like that, there's just, if you're complaining of ear pain, you don't want to leave someone with an untreated ear infection. So I see why they get treated, but yeah, I think the jaw is just, it mimics so many things, TMJ issues mimic so many things that it's usually the last thing that people think about.
Yeah.
So
yeah, I've heard all kinds of things, but we don't have to get into that.
Okay, so I kind of covered this. So a lot of people are presenting without a jaw complaint. It can present as ear pain, fullness, even ringing in the ears, pain radiating down the neck or to the back of the head, even facial pain. And then I've actually seen a case of visible facial swelling that resolved after treatment of the jaw. And then, of course, clicking, popping, trismus, which is difficulty opening your jaw. And so those are pretty obvious signs that the jaw is malfunctioning. But
yeah, definitely. And these are a lot of things that we'll see in the clinic too.
Yeah.
Yeah.
So yeah, first step, take a thorough history. The timeline of things are very important. Like I was saying earlier, like starting new medications, of course, aggravating and alleviating factors, what makes it better, what makes it worse, and then doing a thorough head and neck exam. I always like to do a hearing screening or a formal hearing test to make sure there's not something deeper in the ear that is causing a problem. Tympanometry is a pressure test that we can make sure that the eardrum is moving well, so there's no fluid behind the ear or any negative pressure. And then, of course, potential imaging. I am not a dentist, and so I don't give them a thorough dental exam, but just looking for obvious abscesses or something like that, and checking their bite. And then, of course, palpating the jaw and making sure that is it tender? Do they have an asymmetric motion? Is the jaw kind of moving back and forth instead of up and down?
So if you do all of these tests and they all come back normal, then are you going to tend to conclude that a lot of the symptoms are coming from the jaw?
Yeah,
most likely.
It's pretty rare that it's completely normal, but if it were, I still refer to you to at least I'm like, yeah, it's like the least invasive thing we can do, right? Like, let's start simple and let's do physical therapy before we expose you to radiation for imaging and all that kind of stuff. So
sure.
All right, so again, just avoiding certain aggravating factors. I like to go through their diet and lifestyle. I like to ask them if they chew gum and eat all the crunchy things, and then usually treat any ENT conditions that might be happening alongside the jaw issues. Education is really important to me. I like to take the time to give them a handout and review it with them and teach them, things like relaxing the tongue along the roof of the mouth and, things like that to help relax the jaw. And then referring to PT, or if I do notice a dental issue or I am concerned about that, I'll refer to oral surgeon. We do have a Mouthguard. I always tell them the dentist is going to be better, but I usually have people try the $20 Mouthguard to make sure they're not spitting out $500 down the road. So, yeah, that's our treatment of jaw pain is pretty limited. We usually let you guys do all the work as far as treatment goes.
Thank you.
Yeah.
And this is a lot of times where we start with our treatment too. There's so much education that has to go into it. So I'm glad that it's not coming just from us. So if more than one of us is saying it, our patients tend to buy in a little bit more and follow along. So these are all really important points that we try and cover in physical therapy too. Okay, so then they come to us and see a physical therapist. I think a lot of people don't even know, kind of like seeing an ENT because of symptoms related to TMD. They don't know that PTs can treat the jaw also. I will say not every PT enjoys treating the jaw or has experience in treating the jaw. In physical therapy school, it's like a half a day that we spend on it. So people who do treat it go on and take additional coursework to really become proficient in it. And so when you're looking for a PT, if you don't know where to go, just start asking about educational backgrounds and things like that, and make sure that your therapist really likes working on the jaw, because you'll get better outcomes that way. But we do treat the jaw because it's a part of the body and we love anatomy, as mentioned earlier. So when someone comes to a physical therapist for their TMD, there are a couple of things that we're going to look at. First of all, we're going to measure how much mobility you have in the jaw. So we look at how far can you open and close your mouth? Is it getting stuck anywhere along the way? Are you able to protrude your jaw and stick it out forward like you're making faces at people? And then can you slide your jaw side to side? Those are all key motor functions of the jaw. So we want to make sure that everything is symmetrical and that everything is moving properly. And along with that as well, we talked earlier about how those structures of the jaw overlap with the neck. And you even mentioned how neck pain can contribute to jaw dysfunction and vice versa. So we always examine the neck and look at range of motion and mobility in the neck as well, along with posture and strength of the muscles in the neck and in the jaw as well. And then as we watch somebody's jaw move, we want to look at the mechanics of that. Is the jaw opening straight up and down, or does it deviate to one side more than another? Is there clicking and popping that's happening in the joint? And if so, where is that coming from? And in what part of that motion is it occurring? So we want to assess all of that. And then we actually, we get our fingers in your mouth and we start poking around in the joint and checking joint mobility as well to see if there's enough motion in the joint or if there's restrictions in the capsule that surrounds the joint. So all of that tissue, we want to make sure that it's mobile and functioning properly. And so the only way to do that is to get our fingers in there and start moving the jaw around.
I can speak from personal experience. I've had that done. It is, it's interesting.
You don't expect that when you go to a physical therapist, right? There's a lot of treatment options that we can do in therapy. And so one of the go-to number one things that we're going to do are exercises. Along with those lifestyle changes, you could see a PT once or twice a week and it's great. But if there aren't things to follow through with when you go home, you're going to have a harder time recovering from whatever's happening in the jaw itself. So we want to make sure that you are stretching the muscles that are tight and strengthening the muscles that are weak. And a lot of that comes down to working on posture. And I have some examples of this in a few slides. So we'll talk about that in a little more detail and why posture is so important to how the jaw functions. I think we overlook that quite a bit. And we also want to re-educate how the jaw moves. So if you're someone whose jaw pulls to one side or the other, or there's an abnormal curve in the mouth, in the mandible when it opens, that's because the muscles aren't firing at the right time. We've learned these abnormal patterns usually to avoid pain. And so we have to work backwards and get the jaw working symmetrically so that both sides of the joint are opening and closing at the same time. We also, again, get our hands on and start working on the neck tissue and mobility, working on joint mobility of the neck, and then getting around the muscles of the jaw. So all those masticatory or chewing muscles and making sure that they function. I'm glad I said that word, okay. Good word. Working on those. And then also, again, checking the joint mobility and getting that restored to where it needs to be. And education, and why we're doing what we're doing, and lifestyle modifications and things that you can do immediately to start making changes to improve your jaw symptoms. When we have a forward head and weakness in our muscles, unfortunately right now, we tend to be forward a lot. So we spend a lot of time on devices where our head is forward, or at work, we're working on a computer. And the more forward our head tends to go, the weaker the muscles become in the front of the neck and the tighter they become in the back of the neck. And we develop this forward head posture. And when the head comes forward, it actually compresses joint space in the jaw itself and puts additional pressure on it. So if you have an irritation of the jaw and you have a forward head, you're just adding to irritation and inflammation and problems in the joint. So posture is really important to address when we're working with TMD. We want to address stretching, and there are stretches that you can do for all of these muscles around the jaw. These are some examples of things that we do for people who have tightness in their masseters. Again, those muscles that help close the jaw on the side of the face and up above the eye and that temporalis muscle. These are great things to start trying immediately. You just use your fingers, and as you perform active motion, so you open your mouth and push into those muscles, either through that masseter in the cheeks or up through the temporalis muscle on the sides of your head. Those feel really good. And then, you're like, I love that one. Favorite. It's everybody's favorite. The pterygoid stretching, that again is that little muscle that attaches to the disc. So if you're having problems with the jaw getting stuck, opening or closing, we tend to see tightness in that pterygoid muscle. And so the only way to reach that is by getting into the mouth and getting to the front of the joint, back by the molars, and then pushing out into the cheeks to get that muscle to release. And it's not necessarily the most pleasant thing when we're doing it, but it's one of the most effective techniques I think that we use. And then we can start to stretch the neck as well, because those tissues overlap the muscles of the jaw. So this is one of my favorites, this upper trap stretch. It's nice and portable. You can do this in your car at stoplights, or you can do this when you take little breaks at work, but you can just tip your head over to the side and immediately feel a stretch on the other side. I don't know anyone who doesn't have tight upper traps. Right. Strengthening the neck and postural support muscles requires working on some deep neck flexor muscles, and those are in the front of the neck. They sit behind the throat. And so chin tucks are one of the best ways to start working on that muscle group. We can do these laying down or sitting up. Sitting up, a chin tuck is super flattering because it gives you a double chin. So if you keep your head nice and level and pull your head straight back, you get a nice double chin, but you're also working on those deep neck flexors to help strengthen your postural support muscles. We also want to work on the muscles around the shoulder blades, because as our head comes forward, our shoulders tend to round out, and we want those up and back as well. So squeezing the shoulder blades together and working on those muscles are also extremely helpful. We can also strengthen the muscles around the jaw itself too, with isometric exercises where you're pushing into your hand in all the directions that the jaw moves, so side to side, opening and closing, and even protrusion where you stick your jaw forward. And you push against resistance and hold that posture for 5 to 10 seconds to help strengthen those muscles too. That can help correct abnormalities with opening and closing when we get those pulls to one side over another, and helps re-educate those muscles. We can also use clothespins a lot to help strengthen the bite. If you try and bite down onto a clothespin, it's like squeezing a little weight with your teeth. We can also turn the clothespin around and stick it between the teeth and open the clothespin so that it helps stretch the joint capsule as well, instead of us getting our fingers on your teeth and wiggling the mandible around. So it's a nice way to do it yourself. And again, movement re-education. So getting in front of a mirror and making faces at yourself to try and teach the jaw to open and close without any of these abnormal pulls to one side or the other. So controlled opening is placing your tongue on the roof of your mouth behind your front teeth and opening and closing your jaw in a nice controlled manner without allowing it to deviate to one side or the other. And also without pain or clicking and popping. So this is a nice exercise to get started with almost immediately with everybody, because most people that come in with pain have difficulties with controlling how they open their mouth and in the direction that their jaw is moving. And we can also work on that side to side motion, either without anything between the teeth, or sometimes you can put like a tongue depressor between the teeth and slide the jaw side to side. So you have a little bit of feedback of how you're moving to make sure that you're moving in a normal manner. Want to talk about some lifestyle modifications?
Sure.
Yeah.
So of course, anything that's really crunchy, you want to avoid, try to do a soft diet. So definitely no gum. You want to watch almonds and carrots and other hard vegetables, and anything that causes repetitive motion or significant crunching or anything. Controlling how wide you open your mouth when you eat or yawn, or we were just talking about singers before the presentation started. Just trying to manage avoiding opening your mouth too wide. Smaller bites will help with that too when you're eating. Avoid eating, a whole apple or something. Chopping it up into little slices.
Big sandwiches,
yeah, big
right?
sandwiches, yeah. Applying heat or cold, and then, of course, making sure you've got some good ergonomics and watching your posture. Even when you sleep, that can affect it too. I find that, side sleepers tend to have a little bit harder of a time because, you're kind of pushing that jaw to the side all night, and then you wake up and it's sore. So I usually try to have people sleep on their back if they can. But sleeping on the stomach too, having your head turned to the side can cause some issues, along with other neck and back issues too.
Mm-hmm.
And then of course, relaxation techniques can help too.
Yeah, I think on a personal note, two things. Well, controlling how wide you open your mouth. I try and tell people, again, there's that controlled opening exercise where you put your tongue behind your teeth and open and close your mouth. When people are in a really acute flare-up of their symptoms, I tell people that that's as far as you should open your mouth. Your tongue should stay on the roof of your mouth and you open and close, and that is the range of motion that we want you in until everything starts to calm down.
Yeah.
And then we can progress it from there. And then sleeping, I think one of the things that we get asked a lot just in therapy in general is, what pillow should I use?
Oh, yeah.
And so many people have the contour pillows now, which are really great if you don't move when you sleep. But we were on vacation and I don't have jaw pain. And I end up on my side 100% of the time. And my jaw, I think, was on the bump of the pillow, which pushed my jaw over, and I was waking up every day with jaw pain, which I normally don't have. And it took me a while to figure it out. But yes, sleeping posture is so important to address because it will cause problems in people that normally don't have jaw dysfunction. So I'm glad that you mentioned that. You talked about ergonomics too, and that's just a big word for meaning making sure that we're in alignment when we're doing our daily tasks as much as we can. So when you're sleeping or when you're working, again, this comes back to posture and how the body sits and whether or not you're putting excessive strain on the jaw or not. But you want to keep your back in as much of a straight line as possible, whether you sleep on your side or if you sleep on your back. I can't sleep on my back. I know
It's hard.
it is so hard to do. So if you do like to sleep on your side, making sure that you're not putting too much of a pillow under your head that would tip your head toward a shoulder. You want everything to remain in a straight line. And then when working on a computer or using your phone even, you want that screen up toward eye level so that you're not bending your head down throughout the day and you're reducing that forward head posture that increases strain and stress to the jaw itself.
And then these are other things to think about in when you're managing jaw issues. So again, referring to a dentist. If you haven't gone in a while, it's kind of just a good idea to go in general. But if we see an abnormality, we'll definitely send you there. And then, of course, maxillofacial, oral surgeon, orthodontist. I mentioned the mouth guards earlier. I usually have people try the over-the-counter $20 mouth guard just to make sure you actually hold it in your mouth when you're sleeping. And then thinking about medications. Some offices provide Botox for jaw pain and management of TMD. And then surgeries are usually, last resort. I'm going to try to avoid that, but some situations are just pretty severe. One thing I didn't mention in the ENT slide was a lot of things that I see too is with nasal congestion. And so if you're a chronic mouth breather because your nose isn't working, then we can kind of address the nose as well in our office with either a sinus surgery or, we do something called a turbinate reduction. You've got some swollen tissue in your nose and we can reduce that swelling and help you breathe better through your nose so you can close your mouth so it doesn't strain the jaw. So
that's a great option. Yeah. I have a question. What do you see in regards to mouth guards? Do you find that people like them or do you sometimes see that the mouth guard makes their symptoms worse?
That's a good question. I have had people say that the mouth guard makes it worse. I feel like it's there to provide a cushion to protect your teeth, but also sometimes people clench when it's in.
Yeah.
I think that's also a good reason to start with the cheaper one because they are not covered by insurance and usually they're like $700 or something like that. So I like to try the cheaper one. Of course, the molded one is going to be a lot better, but I do like to have them try the cheaper one first.
Yeah.
But yeah, I think it's so variable. It's different from patient to patient.
I always tell patients to go back to their provider and talk about problems that they're having with their mouth guards. I think some of them too pull the jaw forward and it changes the position of the joint.
Yeah.
That sometimes can make it a little more irritable too. So I don't know if those are the best candidates then for the mouth guards, but then if you're grinding your teeth, that's not good either. So
right.
Yeah.
I have had a couple of people with that are trying to manage mild sleep apnea, and they've got an oral appliance that pulls their tongue forward, and then they start having some jaw issues. So that could be something to look for too, like managing sleep apnea in a different way if that seemed to be an aggravating factor.
Yeah, that's a good point. Yeah. Okay, wow, we made it to the end of the slides already, so that's fantastic. Is there anybody that has any questions that they'd like to ask us? There are 9 little buttons in the corner of the screen down on the right-hand side, and you can click on those. And then there's a Q&A tab that comes up, so you can go into there and ask a question. Otherwise, you can raise your hand or type something in the chat to see if anything comes through. We'll stay on for a minute. Let's see. Oh, Jen. Okay, I need to unmute you, Jen. Jen, go ahead and ask. Yeah.
Hi. Okay, so when I work with patients that talk about how they are always clenching, my go-to for them is to say to pick something that happens a lot throughout your day and use that as a check-in point. For example, I had a server, so I said every time you print out a ticket, use that as a time to check in. Am I clenching? I was wondering if you guys have any other tips or tricks for clenchers.
That's really good.
Yeah.
I just usually tell them to try to be as aware as possible, and but that's a good tip. I don't really have.
Yeah, I've actually had people set timers, especially people who are working at a desk all day. They tend to get they don't have little breaks like a server would, where there's a routine task that's happening. And so setting a timer sometimes can be a helpful little reminder every 15 to 20 minutes to do a posture check in general, to make sure that they're not so far forward, and to also then make sure that they're not clenching as well. And that's a really good time to throw in one of the little stretches if they're able to counteract any clenching that they might be doing unconsciously throughout the day. That's a great question, Jen. Thank you.
Thanks.
Okay, we had another question come in as well. Okay, Ashley, would you like to start with this one?
That's a good question. So I have had
should we read the question?
Oh yeah, sorry.
Yeah.
Thank you.
Yeah.
So is it possible for tinnitus to be cured if TMJ issues are diagnosed and treated? I have had that happen more than once on multiple occasions, where they kind of presented with this new onset ringing in the ear, and everything was normal. Their hearing test was normal. We sent them to physical therapy, and their tinnitus was gone after treatment. So there is I guess the official answer is there is no study that proves a cure for tinnitus, but there are multiple reasons to have that. You can have a medication-induced tinnitus that if you stop the medication, it fixes it. So same thing with the jaw. If the jaw is the only issue that's causing it and you treat it, I have had that resolve.
Yeah, and I tell patients too, if that's the primary reason that they're coming to physical therapy, and sometimes it is, that's their goal, is to get rid of the tinnitus because it's so disruptive to their daily life. We always give it a try and see if we can change things. Sometimes we're pleasantly surprised with the results. Again, if we can get those structures around that trigeminal nerve, especially, to calm down and stop the irritation to that nerve, that will refer symptoms into the ear, we do have some success. And sometimes we're not even necessarily trying for that, and it's a fun secondary benefit that we get. I just worked with someone recently who was having difficulty hearing, actually felt a lot of pressure and fullness in her ear. And the greatest thing that came out of therapy for her was that she could hear the clock ticking in my treatment room by the time we were done, and she had never noticed it before. So it's definitely worth trying, but there's no guarantee that it can cure tinnitus or tinnitus, because there's so many different reasons why that can occur in the first place. That's a great question, though. Does anybody else have any other questions? If no one else has anything else that they'd like to add, we're just really thankful that you joined us today for this webinar. you will get a link to the recording so that you can watch it later on. And if you have any questions or thoughts afterwards and would like to reach out to us, we can make sure that there's a way to contact myself or Ashley in that email as well, so that you can reach out and to us directly and get some questions answered that way. I'm going to go ahead and end this webinar, and we want to thank you so much for joining us today.
Thank you.